Hello everyone, Dr. Cary Yurkiw here. Welcome to today's webinar, and we're talking about joint pain and arthritis, and we're live on YouTube as well as on Instagram. So if you have any questions, please type your questions in the chat, and I'd be happy to answer those for you. We just want to talk about joint pain today and what causes that, and then what is arthritis, and then how we go about treating that. If I have time, I'll read a little bit from my book called Neck Pain, which is on Amazon. And there's a chapter in there that where we talk about arthritis. And so I'm hoping to be able to read that, a little bit of that to you today. So for joint pain, what causes joint pain? Well, joint pain is caused by injury, and it's caused by wear and tear. It's caused by inflammation, infection, and systemic conditions. So joint pain is caused by a number of different things. The most common one I would say is injury. So when somebody gets injured, maybe it's a sporting event or in an accident, it can strain and sprain the joint. And we classify sprain and strain into three categories: first degree, second degree, and third degree. So we see that in the clinic in various joints. It could be in the spine, it could be in the shoulder, it could be the knee, the ankle, the hip. So we see a number of different joint sprains. Also, wear and tear can cause pain in the joints, and wear and tear is arthritis, where the joint starts to break down. And we'll talk about that in a second and how people do get arthritis and the different forms of arthritis. Inflammation causes pain because when the joint gets swollen, there's only so much room in the joint. So there's a capsule in the joint, and if that capsule has inflammation, it starts to expand. There's stretch and pain receptors in the tissue in the joint, and that causes pain. So you're going to get a nerve impulse from swelling and expansion of that joint and the ligament stretching. Infection can cause pain, and that's not something that we deal with in the clinic, but sometimes infection can be present, especially if there's a puncture of the skin or some other underlying condition, and that needs to be treated at the hospital or by a medical professional to deal with the infection. And then systemic conditions. So systemic conditions like rheumatoid arthritis or other types of arthritis, lupus, psoriatic arthritis. These are conditions where people have, let's say, psoriasis, and their joints are getting inflamed because it's a byproduct of the underlying condition. So people have joint pain from a number of different, for a number of different reasons, and some of these are listed here, and so we want to address those inflammatory conditions, those joint pain conditions, and help people with that. So what is arthritis? Well, it's inflammation of a joint. And there's different forms of arthritis. There's osteo, there's rheumatoid arthritis, and then there's the other forms like psoriatic arthritis. By far, osteoarthritis is the most common one we see. So osteoarthritis is a wear and tear of the joints. And sometimes it's as simple as the person's had poor posture. Maybe they've had an injury in the past. They have to compensate and walk a certain way to maybe a little bit more weight on the right side than the left. And that causes the joints on the right side to break down quicker than the left side. It's kind of like a car that's out of alignment. Over time, the tires are going to wear out faster on one side than the other. So as a health professional, we want to assess the person for arthritic conditions like osteoarthritis. Sometimes we'll take x-rays in the clinic. We have a digital x-ray, and we'll determine what the condition of the joint is and then recommend the proper care for that. If it's rheumatoid arthritis, it usually affects many different joints in the body. It's a systemic inflammatory condition, and so for that, the treatment's different. And we want to help the patient to manage that condition, to give them the best advice possible going forward so that they can help themselves. But as a health professional, we also want to help them to manage their rheumatoid arthritis, reduce the flare-ups, reduce the pain and increase the function so the joints stay healthy for as long as possible. And then there's other conditions like psoriatic arthritis, and we don't see those as often, but there are other reasons why people do get arthritis. So what do we do to help? As a chiropractor, what we do is we assess the person. So we want to do a history, understand the background of the condition, and then we want to do a physical examination. And when we do that, we want to determine which joints are affected. Sometimes there's just one joint, sometimes there's many joints that are affected, and we want to be able to do our best for the patient with those joints that are arthritic. We want to treat the person, so we want to treat them with chiropractic adjustments. We want to treat the person with some bracing, with some exercises, and even talk about things like nutrition. And we want to give them the best advice possible, because by eating foods that are anti-inflammatory, that could help them, avoiding pro-inflammatory foods. Things like fish oils can be very helpful. Getting enough rest or sleep, using ice or heat, those types of things can be very beneficial to the patient when they go home. So we want to give them the best advice possible in between sessions. I am going to read from my book called Neck Pain. I'm just going to switch over to that right now. And in my book called Neck Pain, which is on Amazon in ebook, paperback, and audiobook, I do talk about arthritis and inflammation. So I'm just going to skip over there, and we're going to go right to that chapter on arthritis, and I'll just read from that. Arthritis is something that I see in the clinic every day. The word arthritis comes from the word arthron, meaning joint, and itis, which is a disease or a swelling of a structure. So arthron meaning joint and itis meaning swelling. Inflammation is a common reaction to the body's being injured and needing repair. If joints are out of place and inflamed, they are prime candidates to break down and become arthritic over time. There are different types of arthritis, namely osteoarthritis, rheumatoid arthritis, and psoriatic arthritis among the most common types. The most prevalent arthritis I see is one that affects the bones in the neck due to poor alignment. This breaks the bones down, and it's called osteoarthritis. Autoimmune and systemic inflammation like rheumatoid arthritis is significant too, because it has potential complications to the way we do adjustments in the clinic, especially in the upper neck region of the spine. Autoimmune diseases like rheumatoid arthritis can weaken the ligaments and increase instability of the bones in the neck. Some patients think that osteoarthritis is part of normal aging. That would mean that everyone who's 40 or 50 or 60 would have a spine that would look the same on x-ray, but that's not the case. It's not true. I see a wide variety of conditions in people of all ages. I have seen 30-year-old spines look twice their age. Age does play a part in the healing process, as it takes longer to heal the older the patient is. There's more of a chance of injury the longer you live, and with the slowing of the repair process, it will make it more difficult to recover. But all hope is not lost, and the patient does not have to learn how to live with their condition and accept that they're getting old because they have arthritis. Yet many patients have been told that they have arthritis and they must learn how to live with their condition as it's part of the normal aging process, but that's not true. A good analogy for the arthritic process is the alignment of a car. If the car is out of alignment, the tires and the wheel joints will wear out unevenly, and one side of the car will start to wear out much faster than the other. The joints may begin to squeak and rub, and the tires will wear bald on one side faster than the other. So that's a good analogy for arthritis and what we see in the clinic. And I wrote about that in a chapter in my book called Neck Pain. In that book, we cover whiplash, concussions, and headaches as well. So it's a really good book. It's on Amazon. I'll put a link in the show notes below, and you can easily go over to Amazon, click on the link if you're on Instagram in our bio, and it'll take you right over there to the options of booking an appointment, going to Amazon and finding that book on neck pain, and following our channels like YouTube and our podcast channel. So you'll get all the options there in the menu. We are accepting new patients right now. Usually we can get a new patient in within 48 hours. So if you want to come to our clinic, you can scan this QR code in the top right corner, and that will that QR code will open up a link, and that's going to enable you to book an appointment very easily right from your browser. You can click on the link in the show notes here on YouTube, and that'll take you to our menu, and then you can click on book an initial visit. And so that's really easy. And the process is so simple. It's just, your first name, last name, phone number, email address. You pick a day and time that's good for you. We have quite a few options in our calendar for scheduling. And once you book that, we're going to send you the paperwork in advance. And then what we're going to do is follow up with you via text, let you know, remind you when your appointment is. And then when you come to the clinic, we'll be able to get right into your history, do an assessment, and then recommend treatment for you. So everything's pretty smooth and streamlined, very easy process. And we hope that you've enjoyed this webinar today on arthritis and joint pain. And we look forward to talking to you again soon. Please follow our social media channels here on Instagram, Facebook, and Twitter. Pretty simple, at Dr. Cary Yurkiw is our handle on all three, including on YouTube. Subscribe to that channel. And our podcast is called Super Healthy. It's on Android and Apple. Follow that podcast. And when we do webinars like this, you'll get the audio version of it. And that'll be, you'll be notified by your podcast provider that the next episode is available. So thanks again for joining us today, and I look forward to talking to you again soon or seeing you in the clinic.